The sequence of events that occurs in a single heartbeat is known as the cardiac cycle. There are two main stages for the ventricles, diastole and systole. Diastole is when the heart muscle is resting and the chambers are filling with blood. Systole is when the heart muscle is contracting and generating force in order to push the blood out. The cardiac cycle is represented by the Wiggers diagram, named for Dr. Carl Wiggers, MD, who developed this visual representation of the events that occur in the left ventricle. This is a series of measurements from a single heartbeat that includes the electrocardiogram, aortic pressure, left ventricular volume, and left atrial pressure, which is not shown here. Looking at a series of 4 beats, we can see the electrocardiogram tracing. The electrocardiogram represents the electrical signal to the myocardium to contract. The corresponding pressure waveform from the left ventricle can also be seen with it. The large rise indicates the pressure generated by the ventricle to push the blood out. The aortic pressure aligns with ventricular pressure when blood is leaving the left ventricle and shooting out into the aorta. The cardiac cycle begins with blood returning to the heart and filling the atria. The right atrium is getting blood from the superior and inferior vena cava, while the left atrium is getting blood from the pulmonary veins. During this time, both the tricuspid and mitral valves are open, so the blood goes right through the atria and fills the ventricles. The chart, however, is indicative of what's going on in the left ventricle. During ventricular filling, ventricular volume is increasing, ventricular pressure remains low, and there is nothing going on electrically. Pressure in the aorta continues to decline since the heart is not sending out any blood yet. After the P wave initiates atrial contraction, blood is pumped from the atria to the ventricles, giving the ventricles one last surge of blood, topping them off. The P wave occurs right before atrial contraction. During atrial contraction, ventricular volume surges upward to reflect the sudden, rapid, small increase in filling. Ventricular pressure shows a bump indicating a rise in pressure from the atrial push of blood into the ventricle. Pressure in the aorta continues to decline since the heart is still not sending any blood out yet. Following atrial contraction, the QRS complex activates the ventricles, initiating ventricular contraction. This is the time the ventricles increase pressure, shutting the atrioventricular valve, but has not quite developed enough pressure to open the aortic valve and eject blood. The QRS complex initiates the ventricular muscular contraction, occurring right before the actual contraction. The diagrams always show this as happening at the same time, which is incorrect because the electrical activity always slightly precedes the contraction. However, due to measurement timing differences, they always show it together. During ventricular contraction, ventricular volume remains constant because blood is not going anywhere. This is what isovolumic means. Iso equals same and volumic means volume. Ventricular pressure shows a rapid rise due to the great increase in pressure as the ventricles are squeezing inward. Since the pressure in the ventricle has not yet reached the same as in the aorta just outside the aortic valve, the aortic pressure continues to decline since the heart is still not sending any blood out yet. This is the phase that the ventricles increase pressure but has not yet developed enough pressure to eject the blood. Once the left ventricle has squeezed hard enough to generate the amount of pressure to equal the diastolic blood pressure, 80 millimeters of mercury for a person with a blood pressure of 120/80, then the aortic valve can open. The ventricle continues to squeeze, but now the blood can finally exit the heart and enter the aorta. You can imagine how much harder a person's heart has to squeeze just to eject blood in people with high blood pressure. Once the aortic valve opens, the aortic and left ventricular pressures increase together as the heart is still squeezing and generating force. At the same time, there is a rapid decline in left ventricular volume because the blood is leaving the heart and going out to the body. There should be no electrical activity at this time. When the ventricle begins to relax, as seen by the T wave, which is the only time the electrical event occurs simultaneously with the muscular activity, the pressure starts to drop. The drop in pressure is associated with a tapering off of volume ejection. The drop in pressure in the aorta causes the aortic valve to close as the blood in the immediate vicinity of the valve tries to go backward into the ventricle due to the dropping pressure here. The blood catches in the flaps of the semilunar valve and seals it shut. The blood actually bounces off the valve and surges forward again and is reflected as a jog in the aortic pressure known as the dicrotic notch. Once the semilunar valves close, blood can no longer leave the heart. The pressure within the ventricle is still very high even though it is declining. Therefore, no new blood can enter, so volume remains constant or flat. This is the isovolumic relaxation phase where blood does not exit or enter the ventricle as the myocardium relaxes. Once the ventricular pressure drops all the way back to zero, the pressure in the ventricle becomes lower than in the atria, which have been holding all the incoming blood. When the ventricular pressure drops below atrial pressure, the atrioventricular valves open and the blood comes surging into the heart. This is seen as a rapid increase in ventricular volume, which is known as ventricular filling. The pressure is low during this time as the heart just passively expands like a water balloon. The aortic pressure is independent of what is going on in the ventricles since the aortic valve is closed, so the aortic pressure just continues its steady decline as blood goes out to the body. There is no electrical activity at this time.